So I'm a peptide guy. I have been for a long time. I probably have 12 times the knowledge of the average person and probably one fraction of what I actually should know.
You said the word epitalon correctly, so yes, we already know that.
Epitalon. But that's a Natalie Needham. Nat's a good friend of mine. So Nat's my biorig coach.
Of course.
But the funny thing is that we in the peptide world, like it's all over the place.
Yes.
Like, you can't get away from it. And most people don't even understand what a peptide is. No. They're hearing this buzzword all over the place. And now we're seeing the cosmetics industry is starting to, peptide infused.
I mean, down there is And1, they got their big patent or whatever with the 0101 or OS01. They've got like the skin therapy form of that. They're down there. I just walked by there just to get here, but yeah, I mean, dude, peptides are all the rage. And honestly, as I spoke about this morning, and I'll just tell you right now, they've become mainstream consciousness for one specific reason. A lot of people won't talk about this because it's a taboo subject, but it's due to vaccine injury. So many people are injured.
I would argue there's two other reasons.
Well,
go ahead.
I mean,
that's the biggest one. I agree.
Obviously, metabolic dysregulation and insulin resistance is a major thing, but that's what really catapulted them into mainstream consciousness, where people are looking for alternative forms of healing.
I agree with that. And I agree that peptides became a big thing post-vaccine.
100%. Yeah. It's all from it's 2023 and on, and as you know, because we've talked about it, but like my book came out and again, no coincidences, but it came out literally on February 1st, 2023.
That's amazing.
And it exploded on Amazon because like it was the first.
Because everybody was looking for it.
Yeah, exactly. I mean, and now subsequently, there's been some amazing books written, and shout out to all the authors that have written other follow-up books and stuff like that. I have a book on GLP-1 peptides coming. It's almost done. It's probably
second reason
a couple
peptides
of months.
have become a big deal.
Yeah, exactly. and we'll talk about that, but like, unfortunately, as you know, most of the media on GLPs is negative.
Correct.
And it should be the opposite. And we talked about that this morning because like the two-stage and three-stage, and not to just rabbit hole and not talk about other stuff, but these are life-altering, transformative drugs if used in a clinically precise dose.
Correct.
And as you know, it has to be microdosed. And there's all sorts of things. I even have the 10 commandments of GLP-1s that we could talk about. But I mean, the truth is that most people do them incorrectly, Mark, because the doctors that are prescribing them to them are looking to make a quick dollar. Yeah. And they start high, go higher, saturate obviously the manufacturer's pockets, the provider has to get paid, and then of course the pharmacy rep that comes in and pushes them. And then as you know now, the big deal is for 2 years, they couldn't make them fast enough, so they gave compounders the ability to do emergency use, and now they're pulling that out of the compounders' hands.
Which gets to the third reason why I think peptides have become such a big conversation, and that is the FDA stepping in and actually starting to make a scuttlebutt about it.
Yeah, and literally as of, in that same thing, in September of 2023, they said these 27, most used, most sourced, most known or well-known peptides are now in classification B, which means may cause harm or not shown to be clinically efficacious, which and I know is a total lie. I mean, absolute total lie. And again, why are they doing that? Because they cannot control, from a patent standpoint, the actual manufacturing and the money making, which with GLPs, they can.
Well, and peptides actually compete with pharma.
100%.
Sorry, that's kind of what we're really talking about here.
Of course. Yeah, and they wouldn't compete with pharma if pharma could actually patent them and sell them, right? But
which is the reason to regulate them, because then pharma will patent them.
100%.
Pharma will sell them and then profit from them.
But I don't know if they can, because they will with the GLPs and they will with the other ones. I think right now, and this is just my personal opinion, and I've been using, for the record, for the audience, I've been using peptides since literally 2004. So it's been my 21st year. I tell a lot of people that and they're like, what? But it was like, back then, it was just like when I was using therapeutic testosterone and you were learning your way on how to use, TRT, TOT, whatever you want to call it.
Right.
We were using, everybody was crowdsourcing like these other things, and ipamorelin came out in 2004, and we're like, oh, this is something you use along with testosterone, and you get better fat loss and better muscle building, right? So obviously things have transpired, and we've moved now into where people are using GLPs for all the amazing reasons that we talk about. But the truth, the real truth is that most people do not use GLPs correctly. Big Pharma wants people to continually use them incorrectly, because then they continually make money, right? Because people are sicker, fatter, more inflamed, more depressed, all these other things. And they never end up finding out that you could use a GLP for the exact opposite reasons and still get much better results.
Well, and part of the issue, I think GLPs are a great way for a person to support behavioral changes.
100%.
The problem is we're not using GLPs as a way to support behavioral changes. We're using it as a cheat code.
Exactly.
And I literally just watched a staff member of ours who's been on what was tirzepatide, I think is what she's been on, which is a GLP-1 agonist, right?
Exactly.
So, and she's been on tirzepatide for nearly a year. And I'm like, you can't even think straight. Like you're so undernourished.
Right.
Like you don't eat food, but you still drink alcohol.
Yeah, I mean, exactly.
Like you'll have a bite of lasagna at dinner and 2 drinks. And it's like, and that's your definition of weight loss. I'm like, or it also means that you probably lost 40% of your muscle mass over the last 12 months.
50. There's 4 things that people have to do when you use a GLP-1, and these are non-negotiable. And the smart doctors that understand this, and thankfully there are some out there, say that it's malpractice if you don't offer this to your patients. But number 1 is you absolutely have to eat enough protein. Okay,
100%.
So you've got
and by enough protein. Tell us.
Yeah, I'll explain it exactly. I mean, the clinical statement would be enough to support your actual lean body mass, but most people don't know what that means because they can't configure how many pounds of muscle they have in their body, especially if they're metabolically deranged.
If we could approximate a gram of protein for each body weight.
The answer is your goal body weight, 1 gram per pound for goal body weight. So if you're 300 pounds and you're a woman and you should be 140 pounds, then obviously your grams of protein is 140. But as you said, most people are protein malnourished. The second thing is, and this is, I think, the biggest thing, is if you start a GLP-1 peptide, because they're so profound in the ability to lose fat and, of course, lean tissue, if you're not hormonally optimized, you're on the wrong path. And so many of these people see doctors.
Women.
Yeah, exactly. So many of them do not see doctors that know how to hormonally optimize them. As you know, Mark, most of them don't even know they're not hormonally optimized. They don't know they have a hormone deficiency. So that's already now down the second path. You're doomed with those 2 things not met. 3 and 4 is, number 3 is, are you weight training? Are you doing bone-bearing resistance training? If you're not doing weight training, you're going to lose muscle again. Then the number 4 is, are you living insulin controlled? Because if you're not living insulin controlled, like you said, you're eating pizza, you're drinking alcohol, you're not changing your dietary strategy. And so all of those things lead up to hormonal loss, muscle loss, dysregulation, thyroid dysregulation, hair loss. I mean, did you hear all these stories, all these lawsuits? There's massive, they're already in category class action lawsuits where they're going after Lilly, they're going after not Mounjaro, but what's the company? The company that makes Ozempic, whatever. I can't think of them right now, but both of those 2 are the biggest primary, and they're all going to get thrown out because once they have actual medical licensed people as the, in cross-examination, they're going to be like, all of this stuff is written, on the actual contraindications of like what you must do, but nobody follows it because, like you said, we live in an easy button world now. Nobody wants to do the work. They want the cheat code.